Hi there, this is Carl Swinson from Diversity, Inclusion, and Exceptionality, talking with you today about the two final invisible disabilities, emotional behavior disorders, and autism. We're going to start with emotional behavioral disorders, and probably the first thing that we ought to do is define that. Um, the federal definition, the one that we find attached to IDEA 2004, looks like this. And the important parts of this is that it's a condition that exhibits one or more of the following characteristics over a long period of time and to a marked degree that adversely affects a child's educational performance. So when we look at these, we see that we have an inability to learn that's not explained by other factors. We have an inability to have interpersonal communication or relationships with peers, inappropriate behavior, a pervasive mood of depression or unhappiness, and a tendency to develop physical symptoms or fears. So, one or more of the following characteristics over a long period of time and to a marked degree that adversely affects the ability of the student to learn. So, if we're looking at others' definitions, and there are many, many, many definitions out there, if we're looking at others' definitions, then they seem to have some very common or recurring dimensions within them. So every one of them speaks to a frequency of occurrence or a rate of occurrence. Every one of them speaks to the severity of the behavior, the length of time of the behavior, and the age appropriateness of the behavior. Those things are common to all of the definitions that we look at. Then there are some things that might vary a little bit. Um, those would be whether it's disturbed or disturbing behavior. Disturbed or disturbing is different. Um, it depends on the definition that you're working with. A transient nature of the problematic behavior. Does it happen across all environments and all situations, or does it just happen in some? And then a variation in social and cultural standards. So as we continue on with this, then we kind of want to look at how we classify uh, or how we come to the determination that someone has an emotional behavioral disorder. Now, we typically come to this conclusion in two separate ways. The first one is a clinically derived classification system in which a trained professional, such as an educational psychologist or a counselor or a medical professional, might use the Diagnostic and Statistical Manual of Mental Disorders, the DSM-4, to find or to determine whether the diagnosis is that of EBD or something else. Um, we have to observe the individual's behavior, generally over a long period of time, in order to make this determination. The other one that is of some concern to us, actually a lot concern to us, is one that um, we see is judgment call, and that has to do with these with teachers who determine through their judgment that a child has an emotional behavioral disorder. Um, that teacher is usually looking at two categories of behaviors: external behaviors and internal behaviors. So when we look at this slide, these problematic behaviors, I think that it's important that you understand that all of these different types of behaviors or dimensions of behaviors can be present in emotional and behavioral disorders. Uh, some of the most common ones are at the top: the conduct disorder, the socialized aggression, attention problems, and immaturity problems are obviously the most important of the externalized behaviors that we see. Um, a lot of the internalized behaviors fall within the anxiety and withdrawal and the motor tension excess, where we begin to see some of these behaviors internalized. And typically, we find more males exhibiting externalized behaviors and more females exhibiting internal behaviors. Now, there's much more information on emotional behavioral disorders um, in our presentation regarding behavior intervention. But for now, I just wanted to introduce this to you as one of the categories and the categories of disability, and I want to talk a little bit about the criteria and the characteristics of this. At this point, I'd like to move into the last category of invisible disabilities, and that is the autism spectrum disorders, or ASD as we refer to it. Um, we have most recently heard from the Center for Disease Control, the CDC, that now it is assumed that 1 out of every 50 school-aged children is identified as having autism. This is a significant increase over what we believe to have been in the past. So um, we can certainly expect to see these within our classrooms. This is, without a doubt, the very fastest growing developmental disability. Um, the the spectrum covers a total of 5 pervasive developmental disorders, and you're probably well aware that it's now in IDEA 2004. It's now in the Individuals with Disabilities Education Act. Autism has been identified and defined within IDEA 2004. Significantly affecting verbal and nonverbal communication and social interaction. We usually find it before the age of 3, and it adversely affects a child's educational performance. Um, this next slide shows you um, what we can expect to see in the 5 different categories that fall onto what we call the autism spectrum. We see on that spectrum, we see autism, we see Asperger's syndrome, we see Rett's disorder, childhood disintegrative disorder, and then PDD-NOS, which stands for pervasive developmental disorder not otherwise specified. Okay, now as you're looking at these, something that's very important is to look at the male-female ratio. You'll notice that in autism, for every female identified with autism, 4 to 5 males will be identified. We find that Asperger's is more common in males, but we also find that Rett's disorder is only reported in females. There is no experience of Rett's being reported in males. So as you're looking at this is a general view of what you might expect to see as far as some of the deficits in each of these. And I want to talk for a minute longer about Asperger, because Asperger syndrome, it seems to be misunderstood, and we need to get past that. We really do. Generally speaking, with autism, we see a triad of characteristics. We see a problem with communications. We see a problem with social skills, and we see a repetitive and stereotypical movement, or repetitive and stereotypical movements. Now, We don't see that so much in Asperger's. We do see the social aspect of the uh, of autism, but we don't see the. We often see that language is very strong, and that we have average to above average intelligence. In a lot of cases with autism, we find that the intelligence level of the child is considerably low. It oftentimes is in the area of intellectual disability. Some of the things that we do see in Asperger's are these common characteristics towards the bottom of the slide: the social awkwardness, the difficulty in understanding nonverbal social skills, difficulty with concrete and literal thinking, and restricted range of interests, very much that we in the same way that we see that with autism. So I want to talk a little bit about the prevalence that we see today. I said that one of 50, um, or one kid on every school bus, typically is identified as having autism. Um, this kind of brings to bear some of the statistics that we've seen. Some of these are old, but you can see that there are significant differences as we're talking here. The National Autism Society of America still reports a rate of 1 to 150. The CDC in 2012 had a study that suggested that 1 in 85. In 2013, the CDC is saying 1 of 50. So either we're getting very much better at identifying autism, or we're finding more children who have autism, one way or the other. I'm not sure what it is, but we're finding many, many more kids with autism in the classroom. Characteristics that we're going to find in individuals with autism spectrum disorders. As I mentioned, there's this triad. We have the social interaction difficulties, we have communication difficulties, and we have the repetitive and restrictive behaviors. Other characteristics that we might run into have to do with um, intellectual disability, or intellectual disability. Um, uh, the video that you see highlighted at the bottom is a good video about a woman who has autism, and how she has been able to learn to communicate over time, even with that disability. The diagnostic criteria for autism is very, very strict, and I wanted to give you some indication of what that looks like. Um, this is taken from the Diagnostic and Statistical Manual of Mental Disorders, the DSM-4, and I want you to see that it's very much a combination of different criteria that would cause a medical professional to make this determination. You see that at the top it says a total of 6 or more items from areas 1, 2, and 3, with at least 2 from area 1 and 1 each from 2 and 3. So very much so that we have to have this mix of diagnostic criteria in order to make the determination that we do indeed see autism within this student. These are some of the characteristics that you can expect to see with autism spectrum disorders. There's going to be some hyperactivity. There's going to be a short attention span, some impulsivity. The self-injurious behaviors will manifest themselves in these anxiety disorders. Oftentimes, kids with autism tend to limit their diet because they don't like particular colored foods, or the texture of particular foods, and so that they simply won't eat them. As you look down through the list, you'll see that kids with autism can have any number of characteristics which will make it a little bit difficult for you to work with them as their teacher. But over a period of time, most often we can begin to interact with kids with autism and can do some pretty good things with them. So we've talked briefly this afternoon about these last two invisible disabilities, emotional behavioral disorder and autism spectrum disorder. Um, if you want more information, please check out the course of study and your textbook. Both of them have um, more resources listed in them. Thanks very much for your time, and that's all I have for you today.